Senior citizens are now eligible to get the coronavirus vaccine, but it could be a longer wait than first expected. News 8's Brandon Lewis of our vaccine team looks at how the process works and where the holdups are happening.
Now, Carlo and Marcelo, we checked with our area hospitals and none of them say they are ready to start vaccinating seniors age 65 and older. Many of them say there's a supply issue. They're still trying to vaccinate those who are in phase 1A and just don't have enough to start vaccinating seniors, including the one that we're following until he gets his.
California is now allowing seniors over 65 to get a coronavirus vaccine. That includes Phil Constantine, who you might remember from his mornings in Chopper 8.
Got to tell you, this is one of the biggest geysers I've ever seen, and I've seen quite a few. Let me zoom out here just a little bit.
I'm not seeing myself as somebody that should be rushing down saying, is it my turn yet? Is it my turn yet? So I'm just going to wait until they say, okay, now if you're over 65, you can go ahead and get it now that we've got everybody that really should have it first.
And that's the same approach the county is taking, focusing its drives exclusively on healthcare workers. Hospitals, too, say they're still trying to get through their staff.
I would strongly encourage the public to not have everyone immediately call your healthcare provider today, because it's highly unlikely they have sufficient quantities.
The biggest holdup is just supply. There are 1 million San Diegans now eligible to get the shot and enough doses to fully vaccinate about an eighth of that.
We need people to be exceedingly patient, not because people aren't doing everything they can to get the vaccines out, but because the vaccines have simply not arrived.
In the meantime, the county is working to sharply increase vaccination sites despite a lot of unanswered questions on future shipments.
We don't know when, and we don't know how many. We don't know which ones.
While Phil is doing his research to prepare for his eventual turn.
I would be somewhat interested. I wanted to wait just a little bit to see if there might be some problems with it, some interactions, bad counterindications for the original as it came out, and it seems like things have been going along fairly well for the most of the folks that have taken it.
Hospitals say they will notify seniors when they have enough vaccines that they can start vaccinating those 65 and older. And of course, we're going to keep following Phil until he gets his.